Hello, this is Mushtaq Memon, Professor Emeritus from Washington State University. We are continuing on our video series on IVM, or integrative veterinary medicine. And this video is focused on retrospective study of 3 years. The horses which were presented at the University of Florida to be given only TCVM treatment. And these horses were attended mostly by Dr. Shea and few maybe by other clinicians at the University of Florida when he used to be clinical professor of integrative veterinary medicine. So these information which I collected and have it analyzed and then published, so these were 164 horses which were covered in these 3 years period, and a very large number, almost 62%, were for musculoskeletal conditions. Then after that, a smaller number was gastrointestinal disorders, and number about 6% were anhidrosis. And I will discuss a little more about that condition, those of you who are unfamiliar with it. So the interesting thing was I was curious about to see what kind of breeds of horses were presented. As you can see here, almost a little over 28% were warm blood, and then 20% quarter horses, then thoroughbred, and few, about 8%, were Arabians. Now, obviously, they were presented for TCVM treatment, so 90% or so got acupuncture, and then out of those, herbal supplement, Chinese herbs, were recommended or given to those almost 80% of these animals. And the acupuncture, almost 70% received electroacupuncture, aqua acupuncture, and a small number received autologous blood injections. As you can see here, the distribution of the horse breeds in a way so that it becomes a little more clear to you to see they are really well distributed in at least these 3 different breeds, and there are a few other breeds that you saw there. And then other breeds, quite a few crosses of thoroughbred, and then you see here the ponies and, thoroughbred crosses I mentioned, so things like that. So there were quite a few different, other breeds too, besides the major breeds we talked about. Then you look at the gender of these horses. Majority, almost, little over 50, about 50% were geldings. And then you have a fair number of mares and few stallions. Now, the present complaints, as I already mentioned, and our numbers there, musculoskeletal was the dominant complaint of these horses which were presented. But I'd really like to call your attention on the other systems which are involved with these horses, which is a proof of this effectiveness or benefit of the TCVM therapies. Then the frequency of acupuncture and our herbal therapies were given. As you can see, again, 90% plus with acupuncture, herbal therapies, and so on. Very long list of Chinese herbal formula which were given to these animals. You can see here there is obviously one herbal formula was which have the longest, or tallest, I should say, bar here. And without spending too much time here, I would strongly recommend that you are to follow up on these herbal formula and see what they contain and how useful they are. And these are the references that you can go back and look for more details. Now, this study was published, which I just talked about, back in 2018 in a refereed, peer-reviewed international journal. And there are a few other chapters in our recently published book on IVM. The chapter written by Dr. Emily Menagan and then Dr. Munsterman are also very useful in support of these acupuncture and herbal therapies. And then Dr. Shea and Dr. Lisa and the Golden Rule book of Dr. Shea, the Red Book, is also very, very useful. So with that, I am going to stop and, look forward to seeing you on another upcoming video here. In the meantime, please go ahead and like, share, and subscribe this channel. Thank you. Bye-bye.